All right, so these are your compartments of the thigh. We'll start with the anterior compartment. The anterior compartment is, majority of it is innervated by the femoral nerve. So start with the iliacus. The iliacus its origin is the iliac fossa. It inserts via the iliopsoas tendon into the lesser trochanter of the femur. And then we have the psoas major, which its origin is the bodies and the transverse processes of the lumbar vertebrae, and it inserts along with the iliacus via the iliopsoas tendon into the lesser trochanter of the femur. Together, they're often called the iliopsoas. The psoas major is an exception to the innervation of the anterior thigh, because it's innervated by the ventral rami of the lumbar vertebrae. Together, the psoas major and the iliacus pass deep to the inguinal ligament. In 60% of individuals, we have the psoas minor as well. Psoas minor, its origin is the T10 to L1 vertebrae, and it inserts in the junction between the ilium and the superior pubic ramus. So you can see it right there. Next, we have the sartorius. The sartorius's origin is the anterior superior iliac spine, the ASIS, and it passes all the way down here and inserts in the pes anteriorus, the medial shaft of the tibia. And then we'll go to the rectus femoris. The rectus femoris has two heads, a straight head and a reflected head. The straight head's origin is the inferior iliac spine, the AIIS, something like that, yeah, anterior iliac spine, and it inserts in the tibial tuberosity via the patellar ligament. Then the reflected head, its origin is in the upper outer portion of superior to the outer rim of the acetabulum, and also inserts into the via the patellar ligament into the tibial tuberosity. And then we have the vastus lateralis. The vastus lateralis, its origin is the linea aspera and the lateral intramuscular septum. Inserts via the tibial tuberosity, tibial tuberosity via the patellar ligament. And then you have the vastus medialis. Its origin is the linea aspera and the medial intramuscular septum, also innervates in the tibial tuberosity via the patellar ligament. So that's all your anterior thigh. So we just kind of covered all that. Next, we'll talk about the medial thigh. So we'll start with the gracilis. The gracilis starts, its origin, we'll start with the medial thigh is largely innervated by the obturator nerve, although there are some exceptions. So the gracilis, its origin is the inferior pubic ramus, and it inserts in the pes anteriorus, the medial shaft of the tibia. And then we have the pectineus. The pectineus is the superior pubic ramus, is the origin, and it inserts in the pectineal line, which is just below the lesser trochanter of the femur. There's an exception to its innervation. It is innervated largely by the femoral nerve, but partly by the obturator nerve. And then we have the adductor longus. The adductor longus, its origin is the superior pubic ramus. Its innervation is the linea aspera. And we have the adductor brevis, which its origin is the inferior pubic ramus, and its insertion is in the linea aspera and the pectineal line. It passes deep to the adductor longus and the pectineus. Its insertion into the pectineus is deep to the pectineal line is deep to the pectineus and the adductor longus. So after the adductor brevis, we have the adductor magnus. Adductor magnus, its origin is you have two heads. So we have the hamstring portion and the adductor portion. So the adductor portion, its origin is in the ischiopubic ramus, and it inserts in the linea aspera. And the hamstring portion, this is an exception in its innervation. It's innervated by the tibial nerve. So its origin is the ischial tuberosity, and it inserts into the adductor tubercle of the femur. So that's the, we just finished the medial thigh, so now we'll do the posterior thigh. So we'll start with the biceps femoris. So the biceps femoris is two heads, the long head and the short head. The long head, it's actually, well, the posterior thigh is entirely innervated by the tibial nerve. So the long head of the biceps femoris its origin is the ischial tuberosity, and it inserts in the head of the fibula and the lateral condyle of the lateral tibial condyle, and then you have the short head of the biceps femoris. Its origin is the linea aspera, and it inserts along with the long head into the fibular head and the lateral condyle of the tibia. And then we have the semitendinosus. Its origin is the also the ischial tuberosity, along with the biceps femoris. It actually shares a common tendon with the biceps femoris. So the semitendinosus inserts in the pes anterius, the medial shaft of the tibia, and then we have the semimembranosus. Its origin actually is in the upper outer surface of the ischial tuberosity, and it inserts in the medial tibial condyle. So that's the posterior compartment.